This is LiveWell Talk on running injury prevention and treatment. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Running is an excellent form of exercise that can benefit people in many ways. However, it does have the potential for injury. Joining us today to discuss prevention of these injuries as well as treatment, Molly Bailey, a senior physical therapist at St. Luke's Therapy Plus. Molly, welcome.
Thank you so much.
So prior to the podcast, we talked, you've been here 10 years.
Mm-hmm.
Okay. Where'd you get your physical therapy degree from?
I studied at St. Ambrose University.
Ambrose?
Mm-hmm.
Okay. All right. And then this is your first assignment at post?
I worked for about 5 years before coming to St. Luke's.
All right.
Mm-hmm.
All right. And you like it?
I
That's
do.
what you
Yep.
said.
Mm-hmm.
It's recording now, so you have to say that. But what type of injuries do you see from running at Therapy Plus? I mean, I know Therapy Plus is not dedicated to sports medicine, but I know you see a lot of these activity-related injuries.
Absolutely. Yep, absolutely. We see both recreational runners and competitive runners. Injury-wise, we're going to see a lot of knee pain, hip pain, runner's knee, and down at the foot and ankle as well, plantar fasciitis, Achilles tendonitis, shin splints, even on up to the back, low back pain, with running. So a lot of overuse injuries, but there can also be the acute injuries that happen with running.
Let's start with the prevention of these injuries.
Mm-hmm.
How can we minimize it? And then we'll talk about the treatment. But what are your recommendations to prevent injury if you're going to take up a running program?
Absolutely. Any strengthening that people can do ahead of time. Runners want to just get out there and run, but if they can do a lot to strengthen, they can really save themselves on the other side of an injury. A training program. If someone has signed up for a race or an event, there are so many great training programs that can be followed, and setting yourself up for success by following it, not increasing mileage too quickly. 10% a week is about the recommendation that you wouldn't increase more than 10% of your mileage per week. And then good footwear. Shoes are a very important part of prevention of running injuries.
Oh,
and then dynamic stretching as you're heading into a run. So a lot of people want to either get going with a run or do, some static or bouncing stretches. But if they can do dynamic stretching, they're going to set their bodies up to be ready for that run.
I was nodding my head like I know what dynamic stretching is, but for the listeners that might not know,
yeah, for those of us who don't know.
Yeah.
Yep. So dynamic stretching would be stretching with movement. You're increasing the flexibility with movement. So think of like when you see the football players warming up on the field and they're doing, all the different moving side to side as they're moving their bodies. It's that, but for runners. So
okay.
Yep. Mm-hmm. Not just like holding, their foot on the curb, dropping their heel down.
Right.
Mm-hmm.
Kind of when they do that strut step and they
mm-hmm.
clap their hands. Yeah,
Yep.
I've seen that. And basketball too. I've seen that before basketball
mm-hmm.
games. What's your recommendation on footwear? I mean, that can be really expensive. So what do you recommend?
Mm-hmm. Yep. When we have patients come and they're asking about it, I think we're really lucky in the area because we have some running shoe stores that really specialize in helping people find the right shoe for them. And so when people can do that and they can go to those stores and have these people look at their feet and find a shoe that's best for them, whether they need more support, more stability, or more flexibility. There's rather than just kind of buying the shoe that looks the best, but finding a good shoe that works for them. And then usually I tell people there isn't one brand that's going to work for everybody. People are going to have their favorites, whether it's Brooks or Hoka or some of the different ones. But when they find a shoe that works, that might be a good shoe for them for a while.
I can definitely say that having two daughters and a wife that are all very athletic and stay active, I do have to step over a lot of these Hokas in the mud porch when I come home. So that's like a newer brand.
Yeah, and the people who like it really like it. Like if it's the right shoe for your foot, they really like it and find it to be a comfortable good shoe. It's a big step over though, isn't it? When you just step over
when
shoes.
You have 6 pairs of shoes that you have to navigate. I want to talk about shin splints. I had those my sophomore year in college during football. They were brutal. Oh my gosh, they were terrible. But what's the treatment for shin splints?
Well, the first step is always controlling the inflammation. That, it is that flat muscle on the front part of the shin
Yeah.
is suddenly having to do a lot more than it probably had to do before. And so there's just a lot of inflammation happening. So, the first step is always calming that down. For some people, that's a lot of ice or anti-inflammatories or, things like that. And then it's moving on to addressing that, the muscle imbalance that's causing it. Is there need to be a little more flexibility, and definitely a strengthening component to bring that muscle, up to meeting the needs of running, football, what have you.
I did it with a beach towel and then would use my toes to curl it
Yes.
in. And that prevented it. And I've recommended that to other people. That's interesting. Another running question. Inside treadmill, outside running. What do you recommend?
I recommend whatever gets you running.
Okay.
So for some people, the treadmill is too boring and they got to get outside. That's what's going to help them run. But for some people, winters in Iowa, they may not be as active in those winter months. And if being on a treadmill means that they run and they stay active, then that's great. You can get a good workout on a treadmill. It may not exactly replicate how challenging, when the ground is not moving for you, when there are less hills and things like that. But if it means you stay active, especially in those colder months, then a treadmill is just as good as running outside, in my mind.
Okay. Well, speaking of treatment of injuries, and when would someone know that they're need to come see you? That's kind of simple. I'm oversimplifying it. Sure, if you have some pain, shouldn't be there. But let me rephrase that question. What is the difference between soreness related, just you had a good workout, as opposed to soreness that may represent pathology? Let's go with that question.
Yeah, absolutely. And that is where a lot of education from physical therapists can be important, because soreness with runners, that's to be expected, as with any athlete.
Right.
And it is finding that recognition of, all right, this is that soreness versus this is pain. This is beyond that normal, my legs feel heavy or they're tired, or the soreness because I'm going up and down the stairs. It is that sometimes a more specific pain, or maybe it's just on one side and not on both sides of your body, on your legs, or it just is more pain than soreness. That would be something to listen to.
And loss of function, right?
Yep.
That's...
Yeah, if it is now getting in the way of your run, if it's stopping you from running. Yep.
Now, obviously, I'm going to guess the first line of treatment's rest. But what does physical therapy do for you beyond rest?
Absolutely. And for some people, rest is part of it, but not the whole part. Sometimes runners are a little bit nervous to come see us in PT because they think we're going to take away running. We're going to tell them not to run, and they don't want to be told not to run.
I have a daughter like that.
Yeah.
She runs track up at UNI.
And
she'd rather not tell you about an injury, not to run the risk that she's going to be taken out of competition. Yes.
Absolutely. So sometimes that's the first...
I totally know this person.
Yes, I assure them, the first thing is that I'm not going to tell you not to run. You're probably going to run anyway. And so just, treatment-wise, we're going to find and treat your specific impairment. So for some people, it's a muscle imbalance. Is it that they've got tightness on one side, weakness through another muscle group, and now because of the repetition of running, that just accumulates over time, and their form breaks down. And so what might be a slight difference becomes more obvious by the time you've done those 3 miles, 5 miles, however long. And so treatment-wise, we're going to identify those impairments and give people a very, specific to them exercise program for them to work on, often, addressing the strengthening and the flexibility aspect. And then for the acute injuries, we have different modalities that we could use to decrease their inflammation. Taping techniques. Maybe they have a high school runner who has a race they need to be able to do. So kinesio taping or other taping techniques that might help them get through this section of the season before they can kind of dive into what's the underlying cause of it. And then we have some modalities like some instrument-assisted soft tissue. So like an Achilles tendonitis, who might benefit from something like that to treat.
Interesting. Hot or cold therapy? What's that's always ice versus warm. Warm feels better sometimes, of course, but that might not be the thing to do early on. Tell us what's the guidelines or advice for ice versus heat?
I would say primarily with the runners, it's probably going to be ice because it probably is an inflammation that needs to calm down. But that's not to say that sometimes they'll benefit from heat. They might have tightness through a hip muscle that will just benefit from some heat to loosen it up, and then they can stretch it better. And for some people, they just do better with heat or with ice. But I would say it's often ice with our runners.
All right.
Mm-hmm.
Well, if someone does have a running injury, how do they get an appointment at Physical Therapy Plus?
Yep, they would be able to come to any of our 4 locations in, we've got one downtown, Hiawatha, Westdale, and Marion, and they would get an order from their primary care physician, and a lot of times those go through electronically, and then our scheduling staff can reach out and call them.
Outstanding.
Mm-hmm.
One last question before we let you go. Why physical therapy?
This comes full circle. I was injured as a high school runner.
Okay.
Yep. And so I did physical therapy, and I'm looking around. I would go before school, and I'm looking around. It's like early in the morning, and like all these people are having fun at their job before, like early in the morning. So that certainly caught my interest, and so I looked further into it, and I knew it was good for me.
I think that's consistent. I've never met an unhappy physical therapist. They always seem pretty upbeat.
Mm-hmm.
And yeah, that's true. Well, Molly, thanks for joining me. This is very informative. This has been great information. Once again, Molly Bailey, Senior Physical Therapist at St. Luke's Therapy Plus. For more information on therapy services, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.